Hello, everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about adhesive capsulitis, which is also known as frozen shoulder. Adhesive capsulitis is characterized by a restriction of active and passive shoulder motions. This usually occurs on the non-dominant side and is 4 times more frequent in females than in males. It usually occurs in females between the age of 40 to 70, but it can occur in males and females of all ages. Again, it is characterized by reduction in active and passive motions. Active is the motion that the person performs, and passive is when someone is helping you perform those motions. Usually it begins with external rotation, which is this motion, and then abduction, then internal rotation, and then flexion. Fibrosis of the glenohumeral joint capsule is accompanied by slow and progressive restriction of movements. These symptoms can come on quickly and usually have a long recovery period. The pain is usually constant and it is made worse by cold weather, and it's usually worse at night. One of the first things to happen is that there is restriction of a ligament called the coracohumeral ligament. This ligament restricts shoulder external rotation. So if this ligament becomes restricted, then that motion is going to be restricted, and like I said before, external rotation is usually the first motion affected with adhesive capsulitis. The functional impairments that occur with adhesive capsulitis are quite restrictive. Many times people have a very difficult time just performing activities of daily living. You think about it, if there's restricted shoulder motion, there's a difficulty in reaching overhead, just reaching into a cabinet to grab something, reaching overhead to wash your hair, to brush your hair, to even brush your teeth, reaching out to grab something, reaching across your body to put on a seatbelt. Many things that we take for granted are restricted and inhibited when someone has adhesive capsulitis. And many times because of this, there is pain in the neck. And this happens because the neck is being overused. There is compensation in the neck because of the fact that the shoulder is not functioning properly. So neck symptoms begin to occur. Several risk factors exist for adhesive capsulitis. These include thyroid conditions, diabetes mellitus, connective tissue disorders, Parkinson's disease, heart attack, stroke, and also there can be secondary adhesive capsulitis if there is a shoulder injury. Could be a fracture, could be a rotator cuff tear, or just a long immobilization can lead to adhesive capsulitis. Adhesive capsulitis can occur in 3 phases. The first phase is the painful phase, the second phase is the adhesive phase, and the third phase is what is known as the thawing phase. Now the first phase, like I said, is the painful phase. There are some folks who do not experience any pain with adhesive capsulitis. They just experience the restriction. But for those who do experience pain, usually this pain begins at nighttime and then it progresses so that it is felt more during the day, even when the patient is at rest. During the adhesive phase, this is when the motion is extremely limited. Like I said, usually the first motion is the external rotation, then abduction, then internal rotation, and then shoulder flexion. And then the thawing phase is a very slow recovery where the patient is getting that motion restored. One thing that I want to make sure everyone understands with adhesive capsulitis is this is restriction of the shoulder motions in the active and in the passive modes. This is very important. Many times there may be restriction in the active mode when there is a muscle injury, but with adhesive capsulitis, there is restriction in the active and passive modes. Again, the active mode is when the patient is trying to do the motion themselves. Right now I'm moving into flexion. The passive mode is when someone is doing the motion for them, and these are both restricted in adhesive capsulitis. This is a very frustrating condition. This is a condition where, like I mentioned before, the activities of daily living are just very restricted. It is extremely difficult to do any type of exercise just because of the limited motion that occurs in the shoulder. This is a condition where as soon as symptoms begin, seek professional care. Get the correct diagnosis. I am a doctor of chiropractic. I have seen this condition in my office. The people who recover the fastest are the ones who get in here when the symptoms first begin. So do not hesitate. Do yourself a big favor and seek professional treatment immediately. Get the correct diagnosis, and that will help to set you on your recovery path. If someone does enter my office and I have done a consultation, the examination, and I have diagnosed them with adhesive capsulitis, there are many things that I can do. First of all, with the restricted motion, I may not be able to adjust the glenohumeral joint with my hands, basically getting adjusted manually, but I can use the chiropractic adjusting tool, and I can also adjust the cervical spine, the thoracic spine, and get the proper nerve flow to the shoulder area. I can adjust the scapulothoracic joint, do mobilization in that area. I can adjust the AC joint and the SC joint. This will help to keep that area as healthy as possible. And also, like I said, treating the cervical spine will help, because many times people get neck pain because their shoulder motion is so limited. So they are having an overload and increased demand in the neck. So treating all those areas will help. Also, passive range of motion exercises, just working through a pain-free range of motion, performing mobilization will definitely help. Now, some self-treatment tips for adhesive capsulitis. First of all, you want to make sure that that is your diagnosis, okay? Please do not self-diagnose yourself. Get professional care. If you have been diagnosed with adhesive capsulitis, one of the first things you could do is what is called the pendulum exercise. The pendulum exercise, first of all, let me back up a step. If you have any type of separation in the AC joint, or if there's instability in the glenohumeral joint, you do not want to be performing the pendulum exercise. But if you can perform the pendulum exercise, how that works is you use momentum from moving the pelvis to help to move the shoulder. This exercise is going to help to restore the motion in the shoulder. You start very gradually working through a pain-free range of motion. You move the hips, you move the pelvis, and this will cause momentum, which will move the shoulder. I have a video about the pendulum exercise. I am going to put the link in the comment section below, and I'm also going to put the link, in the description box below, and I'm also going to put a link to it at the end of this video. This is a very important exercise. Then you could also do self-passive range of motion exercises, where you are using the non-injured side to help to move the injured shoulder. Any type of range of motion exercises should be performed slowly and through a pain-free range of motion. Do not try to overdo it. No pain, no gain is something that you never want to think about, okay? That is a marketing slogan from the 1980s. You want to move your shoulder slowly through a pain-free range of motion. This is going to help to bring blood flow to those muscles, and that will help to increase the motion. You want to make sure that you are constantly moving. You can move the shoulder blades on the rib cage, you can move your neck, you can move your thoracic spine, which is the medical term for the mid-back. Do everything you can to keep moving. This is a condition that is extremely frustrating and may take a long time to recover, even if you are doing everything correctly. So do yourself a big favor. Get professional care as soon as you think symptoms begin, and do everything you can to recover from this condition. Perform the pendulum exercise and perform passive range of motion exercises and active range of motion exercises through a pain-free range of motion. Thank you very much for watching today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to like this video. Please feel free to leave any questions, suggestions, or feedback in the comments section below. Please feel free to subscribe to my YouTube page. If you are watching this video, you are on my YouTube page. My YouTube page is named Dr. Donald A. Ozello, DC. Again, thank you very much for watching today's episode on adhesive capsulitis. Always remember to train hard, train smart, utilize nutritional strategies and supplementation strategies that work for you. Stay injury-free and accomplish your goals.